Now to our GMA cover story, those new headlines about pregnant women and COVID-19. The CDC releasing a report that shows they could face higher risk of complications. And this is, we're learning of a mom who tested negative for the virus, but she then gave birth to triplets who tested positive. Dr. Ashton is here. She's back to break all of this down for us. Okay, Dr. Jen, I know this is exactly in your wheelhouse. Let's first start with that CDC study, because it's the most comprehensive study I think that we've seen so far on this, its impact on pregnant women and the virus. What's the headline out of it for you?
Well, exactly, Cecilia. And we have to remember 4 million babies born in the United States every year. So this is not a small population. We've been tracking this from the beginning because the state of pregnancy represents a compromised immune system. And we know that pregnant women are at higher risk for complications from influenza. Yesterday, the CDC announced that pregnant women face a significantly higher risk of hospitalization due to COVID-19, ICU admission, and need for mechanical ventilation. But the good news is, at this time, they do not appear to be at higher risk of death. And somewhat related to this, Cecilia, I just want to throw in that ACOG, which is our National Professional Medical Organization, is urging the federal government to include pregnant women in the COVID vaccine clinical trials, because we need to know if they will be eligible.
Yeah, that's a big step. Let's talk about that other case that we mentioned briefly at the top. So it's a case out of Mexico. A mom tested negative for the virus. She gives birth to triplets who all tested positive. This sounds like a bit of a head scratcher.
And it is, Cecilia. We're not exactly sure what went on in this case. We think, based on published reports thus far, that what we call vertical transmission, which is transmitting the virus from the pregnant woman to the fetus while the fetus is in utero, very, very rare. So possibility of false positives, we're not exactly sure.
Okay, so how are you counseling the patients that are coming to see you in your office right now who are pregnant, the precautions they need to take, and the precautions the people around them need to take?
So important to really put a bubble around that group. So here's my prescription on this. Number one, any pregnant woman, really double down on those social distancing measures. Very, very important. Do not defer or skip those prenatal visits. That will cause a whole other set of potential issues. And talk to your obstetrician or midwife about wearing a mask, all the other steps you can take. Very, very important. You want to have an open dialogue between you and your obstetrician or midwife, because this is a stressful time, to be sure.
Yeah, for sure. Okay, Dr. Ashton, thanks so much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.